Yeah.
What's going on? What's going on? I heard something pop. Alright, Vlad, I'm just gonna take a look at your knee. Just let me know if there's any pain or discomfort in the movements, okay, buddy?
Alright.
Can you slowly bend your knee for me? You're starting to swell up a little bit, you got some range of motion difficulties. What I do have to rule out is that's check the ligaments in your knee, the major ligaments, to see if there's anything wrong with that. Okay?
Ah, yeah, that really hurts.
Okay. Ah. So our range of motion is limited. It's starting to swell up a lot. It's hard to tell exactly what's going on. I did take a look at your major structures, your ligaments. 3 of the 4 structures look intact. The one I'm concerned about is your MCL. We're gonna see your doctor tomorrow, but it's not looking the best right now.
So what's the deal with Vlad? What's going on?
Okay, so it looks like during the game, when he pivoted and turned, he kind of sprained his knee. I tested out some of the major ligaments in the knee, and ACL, LCL, all the ones look intact. The only one I'm concerned about right now is the MCL. I'm looking about grade 2, grade 3 sprain.
And how long is that approximately until he comes back?
Depending, most likely he won't need surgery, but what we'll probably do is, if he does rehab, probably looking about 4 to 6 weeks at best. Which means it's going to cut it close to playoff time.
Yeah, exactly.
You should, honestly, man, I'm really scared. Like,
what are you scared about, man?
What do you mean?
Like your knee?
Yeah. When am I gonna play again? When am I gonna be back?
Talking about what are you scared about? Just
I've been looking
returning?
I've been looking. This is my last year. You know, I've been wanting to go out with a bang. If this happens, now I don't know what to expect. I feel like I'm lost.
One of the best things I like to tell my athletes is when they get hurt is to really understand about their injury. What we're dealing with is something called an MCL sprain, okay? MCL ligament runs right through over the knee over here in this region. So that's how you see it's connecting the 2 bones. That's going to keep that together. So what you've done by spreading them apart, you've kind of stretched out those ligaments.
Yeah.
So we're going to compress it and keep it iced and keep it all intact. Let the healing happen. What we have to do is we have to support the musculature around the knee. So how's everything going, buddy?
Oh, it's alright.
Yeah. Doing exercise at home and stuff?
A little bit. I'm trying. I don't know. It's just it's been rough, honestly. Ever since it happened, I don't know.
How's it feel nowadays?
Not that much different, honestly, than when I heard it. It's still pretty much the same.
Yeah, it's a little tender sore.
It's been a long time. We shouldn't have left you without a dope beat. Step 2, step 2, step 2, step 2, step 2, step 2. It's been a long time. We shouldn't have left you without a dope beat. Step 2, step 2, step 2, step 2, step 2. Baby girl.
First you don't succeed. Dust yourself off and try again. You can dust it off and try again. Cause if at first you don't succeed, you can dust it off and try again. Dust yourself off and try again. Cause if at first you don't succeed, you can dust it off and try again. Dust yourself off and try again. Cause if at first you don't succeed, you can dust it off and try again. Dust yourself off.
Hey coach, I just wanted to give you a quick update on how Vlad's doing.
Okay, yeah.
So it's been about 2 weeks now since the injury, and he's showing some good improvement. So I mean, he's about typical about where he needs to be. He's doing really good the first week, but now the last couple of days, I think he's kind of regressed. I was wondering how he's doing in practices.
He's not showing that leadership role that he normally carries on the team, and I just feel like he's no longer into it as he used to be.
What we've done in the past with these types of situations is, with these types of injuries, a lot of athletes go through that that frustration phase.
Yeah, exactly.
So I think what we do is we recommend them to go see our sports psychologist, Dr. Gonzalez.
Oh, okay.
What I would like you to do is kind of sit down with him and see how he's doing.
How are you?
I'm alright.
Alright, Vlad, so how's your injury doing? How's it coming along?
It's okay. I'm alright. Hang in there.
And how is the actual leg? Is it better? Let's see.
See for yourself, coach. Look at that. Does that look like a short recovery? I don't think so. When am I gonna be back? I don't know. I want to be out there to help my teammates, but this feels like there's no hope.
Yeah. Well, you know, it takes time. It is hard. It sounds like you're frustrated with the injury right now.
Yeah,
What's
to say
going
the
on?
least, frustrated.
Yeah, it's difficult. I understand. A lot of guys have gone through this. With that said, a tool we could utilize that could really help you right now is our sports psychologist, Dr. Gonzalez. And
Seriously, coach?
No.
Sports psychologist?
She's been a lot of help. She's with a lot of the guys. It has to be your choice, so if you're willing to try it.
Honestly, at this point, whatever you want me to do to get back, I'll do it.
Well, that's great. I'm glad to hear that. I'm going to make an appointment right now with her, and we're going to get started.
Hi Vlad, my name is Dr. Gonzalez.
Nice to meet you, Dr. Gonzalez.
Nice to meet you. So today I just want to get to know you a little bit and I will be asking you some questions. So tell me about yourself. What year are you in?
I'm in my 4th year now.
And how long have you been playing basketball?
I've been playing basketball for maybe, I want to say 7 or 8 years now.
And what position do you play?
I actually play 2 positions on the team. There's power forward and center.
And which one's your favorite?
I like power forward.
Why? What's the reasoning behind that?
Because my style of play is more attacking to the basket. I like to score a lot, so I feel like that position kind of gives me the chance to do that more.
And how's your knee doing?
It's been better. I go to bed, my knee hurts. I wake up, my knee hurts. It's just that's all that my life revolves around now. It's just my knee.
And the rehab?
It's okay when I'm here in therapy and with our trainer, but at home it's a different story. I kind of just think about what's gonna happen in the future, and I kind of just lose hope.
So you're not very motivated at the moment. How's your emotional support?
Right now, since I can't practice, I'm just there sitting on the side watching. I feel like I'm kind of like a second thought. I feel isolated from the whole team concept.
Well, Vlad, we are here for you, all of us, your athletic therapist, me, your coach, your team, and we're going to get you better. We are all a team, but first you have to commit yourself fully to this. This is your injury, you have to be responsible for it.
Thanks a lot, Doc. You make a good point.
Commit yourself,
I like
and everything else will follow, okay, Vlad?
Okay, I hope so, Doctor. Thanks a lot.
One of the best ways to make a great goal is by using the SMART goals. SMART is an acronym for specific, measurable, attainable, relevant, and time-based. So Vlad, what do you think are one of the goals that you would like to work on in order to get back to your best?
Well, I'd like to work on my commitment to my rehab at home.
Okay. Well, that sounds great. We can put it into a SMART goal, okay? And that will be a lot easier for you to follow in the future. So for the rehab component that you mentioned, in order to become more committed, I have set up this goal for you. Always keep in mind that this is just like a formula. So for this rehab problem that you mentioned, if you do it twice a day when you wake up and go to bed for about 15 minutes, you can complete your at-home rehab program starting today until the athletic therapist tells you otherwise. Okay, Vlad, now we're going to work on becoming more positive. The first step towards changing from a negative mindset to a positive one is becoming aware. Okay. You're probably not aware of how many times during the day and throughout the day you're negative, and that can actually really affect your performance and your mood. So I have thought of a few ways where you can change that into a positive mindset. One of them would be thought stopping. Whenever you're having a negative thought, catch yourself and visualize a stop sign and count from 5 to 1. Once you reach 1, think of a positive thought. And this way you'll realize how often you're thinking negatively. Another way that you can become more positive is by using a mantra. A mantra is something that you repeat to yourself that's positive and it's simple. What do you think would be a mantra that you would like to do?
Maybe something like, I can do this, or it's not so bad.
Yeah, those are all good.
Okay.
So you can use those whenever you're feeling down or before practice. Just visualize yourself, I can do this, and picture yourself in your mind like you've done it before.
Yeah, exactly.
You can do it. The last one I will give you to do for now will be changing self-limiting statements to questions. During the day you might think, this is impossible, or I can't do this. And those are negative thoughts, and it will reduce your performance because in your mind you think you can't and you believe that. However, if you change those to questions, saying, how can this be possible? Then it gives you that possibility of, maybe I can. Okay, lads, so today I wanted to see you to work on imagery, and imagery will be very beneficial for you for mentally practicing your routines when you're off the court. So what would be a skill that you would like to visualize, or something, a skill that you think you might need help with?
I think my free throws probably.
Close your eyes, relax. Imagine you are in the middle of the York gym and you have a ball in your hand. Okay, and you're walking towards the free throw line, and at this point you hear the crowd cheering for you. Now what would you do in your free throw routine?
I usually just take a deep breath to try to calm myself down, and then I take 3 dribbles with the ball with my right hand, and then bring it up to about my shoulder level, and then shoot the ball, holding my follow through until the ball goes through the net.
Okay, perfect. So now visualize this and focus on the little details. So focus on the way the ball feels on your hand, the weight of the ball when you're dribbling it, and the noise that it makes on the ground as it hits, and whenever it hits your palm, the smell of the rubber and the smell of the court.
It's almost like I'm there right now, actually. You're just talking to me about it. I feel like I'm on the court right now.
Remember that anytime that you need me, you can call me, email me, whatever you need, I'll always be there for you. Thank you for coming and meeting with me today. Just wanted to debrief you on how the progress has been going with Vlad in these past few sessions. He did bring up some issues. Well, basically he felt isolated from the team. He felt harassed by the players a lot, that they kept asking him and pestering him on when he was going to get better and go back on the court. He really wants to be a leader again, and I think Coach, you can help out with that.
Maybe like in our practices, making sure like he's always participating, and like when we have our team meetings, like he's also engaged in what we're talking about in the plays and whatnot.
That's perfect. Just make sure it's consistent and
and also tell the team, the rest of the guys, to like not necessarily be pestering them, but just like encourage them to keep doing well.
And for you, athletic therapist, Vlad is feeling like he's plateauing right now, and he doesn't feel like doing the therapy at home.
Okay.
He feels very unmotivated at times.
Okay.
We are trying with the goal setting to get him back on track, but I think maybe you can help him out a little bit, be a little bit more supportive in the clinics, and just that you can be aware.
Okay, I've definitely noticed that because I find that he's kind of not being himself the last couple of days.
The motto we have right now with Vlad and I is get better every day.
Okay.
So maybe you two can implement that in your own strategies and just focus on that.
Get better every day.
Get better
That's what we're
every
gonna
day.
do.
Alright,
So
sounds
Step
good.
by
just
step.
keep drilling that into him, get better every day, and
Exactly.
he's gonna be where he needs to be.
Is this thing on? Oh, I thought they silenced us, yay. Power to the people. We living in that 31st century. Futuristic fly shit. The penthouses, the projects, and everybody flies private. New watch, you know what time it is. Watch us. They can't stop us. The prophets, biatches. No one man should have all that power. The clock's ticking, I just
Okay, lads, I wanted to see you today to let you know how proud I am of your hard work. I made a little clip for you to show you what a great player you are.
Feeling my way through the darkness, guided by a beating heart. I can't tell where the journey will end, but I know where to start.
Started.
Zombie on the track.
Started from the bottom, now we're here. Started from